This is the medication drip station. You are on scene of a cardiac arrest patient in which the patient has achieved spontaneous circulation. The patient remains hypotensive after being given a 250 ml bolus. The base hospital orders a 5 microgram per kilogram a minute of dopamine. Your patient weighs 100 kilograms. You may begin.
Again, what is my concentration ordered?
Your concentration is going to be 1,600, 400 milligrams, and a 250 ml bag of normal saline.
Okay, thank you. I'm going to do the pre-existing checklist for my fluids that are already connected. So make sure that I have the proper fluid, which is my normal saline. I want to check the clarity, which it is nice and clear. I want to check how much fluid has already been given, which is roughly 600 mLs of fluid. I want to make sure that there are no medications in this bag of fluid, which there are not. I want to make sure that I have the correct tubing size, which is the correct tubing size right here, which is roughly about a 10 or 15 ml. And I want to make sure that my IV that is connected to the patient is good and not infiltrated. I will open it up, let some fluid run. There's no infiltration. All right, so we are good there. All right. So I am now ready to start the scenario. So scene safety, BSI. I will put on my gloves. I will ask the patient or confirm that the patient does not have any allergies, which the patient does not have any allergies. I'm going to make sure that I pick the correct medication, which will be the dopamine. I want to make sure that it is the correct concentration, correct expiration, and correct clarity, which it is. I'm going to start to cleanse the ports. Let me grab some. I'll be right back. Forgot to grab these. But I'm going to cleanse the ports on my medication using aseptic technique. Throw that in the trash. I'm going to also cleanse the port on my medication bag, which is going to be 250 mLs of normal saline. All right, I'm going to make sure that I pick the correct syringe, which is going to be the 10 ml syringe. I am going to withdraw the proper amount of fluid, which is going to be 10 mLs, to make up 400 milligrams of dopamine. All right, 10 mLs. I'm going to inject it into what is now going to be my medication bag, which is my 250 ml normal saline bag. All right. I am going to dispose of my sharps in the sharps container. I am going to mix the medication thoroughly. Now, I already connected my dilaflow to my tubing. Make sure that is in off position, and make sure that my clamp is clamped. I'm going to now open my clamp and open the dilaflow to run fluid throughout the tubing, which it is. Now I'm going to clamp and turn off my dilaflow. So I have my medications ready. Now I'm going to do my medication math. So the doctor ordered 5 micrograms. My patient weighs 100 kilograms, and I have a 60 drop tubing. my concentration was 400 milligrams in a 250 ml bag. Let's do some math real quick. So to figure out the concentration, it's going to be 400. Divide that by 250, which is going to equal 1.6. Move the decimal place over, 1, 2, 3, which is going to give me my concentration of 1600. All right, so let's do the whole thing. 5 micrograms times that by 100 kilograms times that by 60 drop tubing, which equals 30,000. Now divide that by 1600, which equals 18.75. I always like to double check my math when I have a real patient. So 5 times 100 times 60 equals 30,000. I'll divide that by 1600. There we go. 18.75. Now we're going to round that up to 19. All right. So before we connect, we are going to cleanse the port. Cleanse the port. And make sure that we run our normal saline at TKO. Let's connect the dopamine bag. Alrighty. So we're going to go to the dial-a-flow, and we're going to move it to roughly 19, and we are going to open the clamp, allowing the medications to be administered into the patient. We're going to check, make sure that it is dripping, which it is. We're going to add a medication sticker, John Doe, 225 at 934, and my initials. Attach it to your medications. And now at this time, we're going to recheck the vitals. We are going to assess for any adverse reactions and make sure that our medication is working. Thank you. That is the scenario.